The best treatment is no treatment. If you asked 100 people what would they want from a healthcare system, the right answer is nothing. They want to be healthy. If you ask people, choose best health insurance or just being healthy, they should always choose being healthy. The dilemma is, that's not the system we're in.
Chris Hemphill here with another meeting of the minds by Wobot Health. We are so excited to be sponsored or partnered with the Future of Mental Health Conference, which is helping to expose us to lots of mental health professionals and healthcare leaders that are helping to enact the next wave of change as we drive towards a future in mental health. But one thing that Oleg Tarkovsky here has brought up is just getting all the way down to the fundamentals of what we're actually talking about. Like really understanding, establishing a proper mental model to think about what the challenges we're facing are, and really work from these basics, understand the fundamentals, and build up into change from there. The way that there's a certain lens that we're going to start looking at this in. This is overall helping to develop this mental model for understanding and processing change. And one particular lens, Oleg was speaking on a panel with regards to the quadruple aim. Quadruple aim, I hear it over and over again, and I don't always remember what it is, but I'll say it in one sentence. Quadruple aim is focused on delivering better health outcomes while also delivering a good patient experience at a cost that is affordable without burning out the people that are charged to deliver that care. So I'm really excited to dig in with Oleg, who is the Director of Behavioral Health for Care First BCB, Blue Cross Blue Shield in Maryland.
Wait, quick pause here. Oleg has since moved on from this role and is now the CEO of Carelon Behavioral Health in Maryland. So let's celebrate and congratulate Oleg and get back to the show.
And really get into these powerful ways of thinking about what real problems are and what real solutions are. Oleg, I've been rambling, but any background you want to share with the audience or ideas?
Glad to be here. Thank you for inviting me for this conversation. I think we could not have enough of these, especially when it comes to getting to the bottom of things. Mm-hmm. In today's fast-paced society, especially driven through 24-hour news cycles and the internet, almost everything we are presented with, and then by definition consume as information, is a way to let us stay on top of things. Mm-hmm. Because if you don't, you'll miss something, and that's a lot of the FOMO kicks in, and so we try to stay on top of things. Our natural ability to process information and resources that come at us from this large information machine we call life is a limited resource itself, which means that if your goal is just to stay on top of things, that's exactly what will happen. And we rarely spend enough time, both professionally, personally, or in any sphere of our lives, to figuring out what would it take to get to the bottom of things. And to get to the bottom of things is hard. It requires concentration, focus, attention over long periods of time. And often the most difficult part is, what is it that you're not going to pay attention to? Which means that maybe you are not going to be on top of things all the time, but that's an exchange you have to give in order to get to the bottom of things. And so hopefully we'll have a chance today to get to the bottom of a few things.
That's a great point to make and a great way to word it, because if we're constantly trying to drink from this river that is coming at us in such rapid acceleration, your hand can only skim the surface. You can only be on top of it. So very happy to, I like how you said fast paced, because I really feel like this is an opportunity to do the opposite of that.
Yeah,
do something
slow down.
Slow down and get down. Like it's important to take some time to get to the bottom of these issues that we're focused on, or otherwise that river keeps going by and our hand can't get any deeper. So 2 decades of experience in public, private, nonprofit, and again, our key learning here is establishing this mental model for driving change and having this quadruple aim kind of in the focus here. So Oleg, I've enjoyed our conversations offline. You taught me about a new musical concept. You taught me about like the sensation of like the butterflies that you get when you learn something new or enjoy music. You taught me that that's all from the same pathway. Could you tell me just a bit about your background and what you really hope that people get out of having this conversation and kind of hearing some different perspectives from you?
Sure. So I am a Ukrainian-born Jew that became a religious refugee back in the 1980s, right before the former Soviet Union was collapsing. At that time, the anti-Semitism was rampant, and my parents decided to try to give me and my family better opportunities. And so we left the former Soviet Union before its breakup and eventually immigrated to the United States. And I was educated and grew up, really, came of age the rest of my life in Baltimore, Maryland, and its surrounding areas. I attended college at Towson University, which became my alma mater, and now I have been an adjunct professor of psychology there for the last 17 years, giving back to the next generation, teaching them everything I know about this thing we call behavioral health. Over the years, I've worked in various settings, but also with various populations. I worked in criminal justice system, both with juvenile and adult offenders. I've worked with the social justice system. I worked for nonprofits, running outpatient behavioral health programs. And then for the last 4 years, I've been with Care First, running our behavioral health department, which includes behavioral health care management, making sure that every 3.5 million of our members has access to high quality, affordable, and equitable behavioral health care, but also trying to improve the system at every turn. The system is not perfect, no matter where you look, and so we need to do a lot more looking, lifting every lid and every rock, trying to find ways to improve how the services are delivered, who they're delivered to, what systems we use to deliver those services, including technology, and in many ways sort of highlights this conference with the future of mental health, what is the future of mental health, and really brings us to this conversation today.
Well, I like the connection that you draw between all these things, and I'll even go back to the connection that you helped me draw between the joy of experiencing certain types of music and the joy of learning something that you didn't expect to learn. So when you talk about your life experiences, coming in and escaping the anti-Semitism of Ukraine at the time, all the way to working directly in psychology and working with juvenile offenders, and all the way now to the point of, I would say, addressing a lot of these challenges more structurally. Is there a connection? Is there a link that is kind of the why behind the work that you're focused on?
Yeah. People ask me the why question all the time. My short answer is there is no why. And I'll give you a little bit more details on that answer. So what you hear a lot, especially in high schools and colleges, I have a 14-year-old son who's in high school now, and I work with a lot of college students, undergraduate students, through my teachings at Towson. And in that, a lot of questions are being asked of me in terms of what should they do? What should they focus on? What kind of degree should they get? How can they help the world in focusing on a particular area? And then sort of all of this could be summarized in what I call the purpose question, right? They all want to know where and how should they find their purpose, which is the why question. And my answer to them is stop looking. Go live your life. Do what you enjoy. Spend time with people who you like. The purpose will find you. And when that happens, you're in the right place.
I like that way of thinking because I think that if you're sold an overall idea of purpose at a very young age, it creates an obligation.
Absolutely.
Yeah.
And it's usually a mismatch of your skills. If you're looking for a purpose and whatever it is you find, let's say you are lucky enough to find your purpose. Say it could be computers or healthcare or whatever it is. And yet your skills don't match whatever is required to meet that purpose, you're going to struggle. You're going to struggle mightily. And we see this a lot. We see this a lot in higher professions like medical professions, legal professions. You may make it through law school or med school, and by the way, a lot of people don't. But then as you start practicing that craft, you fizzle out. And usually quickly in those first 5 years, lawyers, doctors, where they find themselves still wanting to be purposeful and help people and do whatever it is that they thought they would be really good at 5 years ago, but their skills didn't match whatever it is they ended up doing. And so stop looking for purpose. If you're good at something and you just keep doing that, you get better at whatever it is you're good at, and you surround yourself with people that support you doing whatever you're doing, it may not make a lot of money, it may not have a flashy name to it, but eventually that will become your purpose.
I know that we have a whole conversation to get into, but it makes me wonder, what's the off switch that you recommend to people? There are people that are extremely driven towards at least the sensation that they have a purpose. So they're searching for the purpose, and they're going down a certain way. And it seems like, if you're driving 200 miles an hour, it's hard to like divert that path. So I wonder, when you say stop looking for the purpose, I wonder if you've recommended like a specific off switch to that purpose hunger.
Yeah, so this one is not necessarily specific to the purpose seeking. It could be applied to many things in life, and it's also sort of counterintuitive. And the advice is quit more. We have an entire society based on what I would call a striving principle. At all costs, strive for something, try harder, do whatever you got to do, sacrifice. It's sort of a outgrowth of early capitalistic way of thinking about things from an economic standpoint. But now it's sort of infected every portion of our society. And so people starting young, whether it's kids, kid athletes or non-sport type endeavors, we push people all the time to go, try harder. If you fail, try again, do over and over again. When in fact, realistically speaking, not everybody's cut out to do everything, especially at a high level. And so what we should be encouraging people more is to quit more and try other things, and on and on and on. Today's basic science on this says that to be a more well-rounded, more effective human being, what you really want is expose yourself to as many different experiences as you possibly can. And it kind of connects to what we just said earlier, right? If you're trying to do everything all at once, you're not doing really anything at all, but the reverse works as well. Like if you spend all your time on being the best soccer player or the best doctor or the best anything for that matter, you're not doing a whole bunch of other stuff that could make you just as good of a human being. And so quit more.
There's a runner, an ultra marathon runner named David Goggins. Have you heard of him?
Uh-huh.
Okay, yeah. So David Goggins, I've been thinking about him a lot lately. I haven't heard as much from him lately, but I think about how he says, like, stay hard when it comes to running. Hit these 50 miles, 100-mile goals and stuff like that, and grind. But I personally run. I run ultra marathons and all that, and it's not like, for me, even though I enjoy hearing David Goggins, like, I find him like motivational and all that, but at the end of the day, it's not that I'm doing it because I'm like trying to find some purpose or I'm trying to grind hard. I just happen to like it. And I feel like if I had, I feel like if there's a lot of people that don't like running, and if they force themselves to stick to it, like I never had the problem of not enjoying it. I actually started running because it would help clear my mind, and it was just like a way to just like be in a space where I could just be focused on running. But not everybody gets that same enjoyment. So I really feel like, hey, don't strive for getting whatever distance. It's kind of self-serving anyway. If you quit, then like if you don't like it, then maybe you can find something else. It's new because the idea that you just presented is new to me. But just curious about, like, hey, this is kind of an effect of quitting.
Yeah. So my 14-year-old got into David Goggins and his videos on YouTube a few months ago, and I don't think he's watching them anymore. But the result was that he started running. And so my wife and I have been running for a long time, she more than I. And for the first time as a family, we got to run together just last weekend in the Baltimore Running Festival. And all of us did the 10K. I think the bigger point that you're trying to make here with Goggins' example, in my opinion, is about the dichotomous way in which we view almost anything. Our society, and it's been this way for a long time, so it's not a modernity issue. In many ways, it's almost a function of our brain and how that translates in day-to-day life. And the idea is that it's easier to navigate reality if we can put it in stark terms. This or that, good or bad, high or low, fast or slow, and so on. And so it's a shorthand, a heuristic. And these have been developed through evolution over millions of years. And for the most part, these shortcuts have been developed in order to make very quick, almost automatic decisions for survival purposes. Well, today, in modern day and age, where for most people, most of the time, we're in a relatively safe time and space, where more people today die from eating too much than eating too little, a lot of these shortcuts are not very useful. And yet, our brains are still practicing the shortcuts today. And so what the Goggins example presents is this notion of pitting really hard work and running the ultra marathons, even though the skin on your bottom of your feet is falling off, versus lazy sloth sitting on the couch, drinking beer, eating chips, and watching TV. When in fact, most of life is somewhere in between. And because it's so gray and not easily definable, that's not what you see YouTube videos about, that's not what's in the news, and that's not what 14-year-olds trying to look hard are talking about.
YouTube videos, except for this one.
Except for this one.
Okay, well, that's a good way to frame it up, because again, I enjoy it, but I don't enjoy the idea of someone feeling completely insecure about themselves because they couldn't accomplish the level that he's accomplished. But you presented an example where, hey, use that as a spark, and but then still, if it's something that you end up not enjoying, that's the opportunity to quit. And if you are honestly, if you find the thing that you enjoy, even though it grinds your feet down to the ground, then that's when that's like stay hard becomes natural at that point.
And most people that participate in activities like that, and it's usually sports, but it doesn't have to be, they find something else, right? So often we talk about purpose as an external concept. And it most often is, right? So purpose, by traditional definition, is not inner focused, it's outer focused. The purpose of X is to help the world be a better place. And again, whether you look for it or it finds you, the result is someone other than you will benefit from this finding. Well, purpose has a cousin called meaning, and that is much more internal. Meaning is how we find joy, satisfaction, some way of making it ours for ourselves, not so much the rest of the world. And so a person that learns to grind through bloody toes after running 50 miles, it's not because they have some greater purpose to show the world how great of a runner they are. It's because they found meaning in doing that activity for themselves. And it has saved many lives.
So getting deeper into that, I know that I promised that we would be delving into the quadruple aim, and I think that this conversation, though it wasn't directly associated with it, I think it starts putting some things into place where maybe we can sit back and look a little bit deeper about what are the things that we're charging ourselves to do and why, as it relates to like the change that we're trying to enact across the healthcare workforce. So the big first question then is like at Care First, we talked about kind of everything leading to Care First. What is your focus? What's your day-to-day in the role directing behavioral health efforts there?
So it's really all of them, right? There's no single focus because that would mean going against everything I believe. And in this notion that there's more than one ball in the air, all four, for example, within the quadruple aim really matter. What differs is the degree to which my focus is needed at any given moment. And so, for example, access is one of the quadruple aim measures. And in a plan like we have at Care First, when it comes to behavioral health needs of our membership, just not so many years ago, access was a problem. Folks had to wait a long time to find a therapist, even longer to find a psychiatrist. They didn't know where to turn to look for those behavioral health professionals. And so I dedicated a lot of my time over the last few years improving that access. Today, I would say it's not a problem because almost anyone, anywhere within our health plan membership can find a behavioral health provider of their choice for whatever it is that they are looking for, whether it's addiction treatment, depression treatment, anxiety treatment, whatever they may need. We have a network designed and purposefully curated, and again, key word here is purposeful. Everything was done with intention to make it so every member could get the access they need to those behavioral health services. Another part of those services and also part of the quadruple aim is the quality, right? You can quickly say you have an unlimited number of providers to get access for behavioral health needs, but how do you know that they're high quality providers? And how do you know that what they're doing is actually resulting in high quality services? We focused on that for the last few years. So measuring, for example, ED use, hospitalization rates, readmission rates, all good indicators for how well your lower level of care provider system is doing, so people don't need to go to the hospital because their medications are well managed. People don't need to end up in the emergency room because less crises are occurring because they're getting to clinicians and services those clinicians provide in a timely fashion. Third component is equity, I believe, of the quadruple aim. How do you know that, for example, people of different ethnic backgrounds, different languages, different genders and other demographics LGBTQ plus population are getting the services that they're looking for within this network that we just described, even though high access, high quality, but is it for me? And again, we focused a lot of our time and resources to make sure that no matter who me is, you can get matched with the service that you need. And that started with just talking to our existing providers and assessing their capability, to now having a function, an online digital function, where folks can literally just sort by the gender, race, language, LGBTQ plus, training, background, and match up with the provider that they think would be appropriate for them.
So digging into that, knowing that a lot of organizations have major challenges on access and quality and equity, and knowing that, I mean, there's a particular market that you serve, and there's a huge variance next door and three doors down. Is that a band? But either way. I wonder there's a framework that you discuss, a mental framework. I just wonder, what can people learn from the journey that you've taken in addressing some of these challenges? I'm wondering what are some, is there a window looking in to
So I think it starts really where we begun this conversation, and this notion of wanting to get to the bottom of things. Because on the surface, most health plans, because of statutory regulations and requirements to meet certain access quotas, if you look at most insurance companies, unless they're really willing to pay a hefty price in fines for not meeting those regulatory and statutory requirements, you'll find that on the surface, they have what they need. It's the willingness, the desire, and then the execution or know-how to actually look under the hood and deeply understand what it is that you have and you don't have. That's an important first step. And then to be willing to do something about it. So let's say you're a health plan that finds that their ratio of African American providers as therapists doesn't meet the ratio of their membership. So if their membership is 20% African American, but only 2% of their providers are African American, that could be a problem for the membership. They need to be willing to do something about it, meaning recruit more African American providers into their network. You start with the assessment, you go to the execution of meeting the results of that assessment. And you have to have both. You can't just blindly start hiring people because you don't actually know what you need. But at the same time, you can't just figure out what you need and never follow up and try to fill that gap.
So we see a problem here. 20% of the population being black, and only 2% of black providers are available to them. What is holding organizations back? Or if you have like an example that you'd like to go to within Care First, curious about like what might have been holding the organization back from addressing it ahead of time, and how you were able to coalesce with your team and kind of enact the change that was needed.
That's a good question. So first of all, I'll tell you that I don't believe that any of it is intentional. I don't think any health plan in their right mind is making these decisions intentionally, saying that we're just not going to have X number of black providers in our network. It's much more complex than that. On the execution side, people need to understand that it is not simple. It is actually quite difficult to be able to, once you recognize that you have a gap, especially such as a demographic gap of any kind, whether it's race, ethnicity, language, gender, to how to then fix that gap. Because in the example we're using here, in the work pool that we could get providers out of, there's not enough, for example, of black providers when it comes to psychotherapists to meet the demand for any demographical requirement. And so what ends up happening is, well, now what? I know I made the assessment, I need 20%, but I know that in my region, I only have 10. What do I do? And so this is where really creativity comes in handy. We at CareFirst pride ourselves in relationship building, in building relationships mostly with local and regional communities. So we have great relationships with colleges and universities that are the foundational building ground for where these folks are going to come out of to then become providers. And so I think that's really one of the very few solutions to this problem, especially early on. And we're fairly early on in this, one of the quadruple aim portions. We're lucky this way in the Maryland, DC, Virginia region. We have lots of colleges and universities with a fairly diverse population of students. And so a lot of this new blood, so to speak, that enters the system is diverse by definition. And then they become diverse clinicians, which then enter our network and are able to serve our diverse membership. For other areas around the country, that may be a lot more difficult to do. And so your question is a good one. And each leader in those areas is going to have to come up with their own ways to solve this problem.
And one thing that you said earlier is that it's not necessarily intentional on the part of the health plan. Today, it's not intentional. I don't know what it might have been years ago, but it just makes me think about, in data science, I work in the world of algorithms, and in that world, you might have heard of high-profile cases in which Black populations were suggested less for high-risk care programs than equally sick white patients because of the way the algorithm was designed and because of the metrics it was optimizing for. So granted, now I don't know the intentions of all of the developers on the algorithm, but whether or not they had good intentions, the result was the same. They created some.
There's actually a really good example of this, but on the flip side, right? We often talk about intentionality or unintentionality. And so the example you just gave is, again, we'll never know whether it was intentional or not, but the result is visible in the data. There's a very similar example, but the flip side of this paradigm in medicating of severe behaviors in children. So, right, in your example, it's the Black population does not get the treatment that the white population gets in a severe case. The one I'm describing is the flip of that. So we know, and we know this by looking at the Medicaid data, that Black children are overprescribed antipsychotic medication for behavior problems in a ratio of 2-to-1 compared to their white counterparts.
So those are two areas that, like, granted, there's gray area because there are bad actors that, but overall, even if that, like whether or not it's intention that brought us here, the only way to get out of it is through intention. Well, talk about it. It's to understand what it is we did or didn't do, to understand what we did wrong or right, learn from it, and change the behavior. Because often, and this is not a very popular train of thought to even bring up in public forums, but I think it's important. And it has to do with the fact that healthcare, especially behavioral healthcare, is a sociocultural phenomena, which means that as primates, we're social beings, and how the interactions amongst ourselves influence everything about us, including our emotions, cognitions, and behaviors, are a huge part of the puzzle. And yet, if we just kind of look the other way while doing the medicine thing, whether it's behavioral or medical surgical,
it misses a whole bunch of stuff that, in my opinion, actually have a much heavier component to, let's say, health and improvement of wellness than even the medications themselves. And yet, it's not a very much talked about subject.
I had a conversation recently with Melissa Riley. She's Chief Growth Officer over at Evernorth, and we were talking about what we're actually looking at when we look at data. I think I say this too much, too. I say this over and over again, but I want to recontextualize how people look at data as not a bunch of numbers and entries and things like that on a spreadsheet, but as a lossy representation of reality. Meaning that reality is let's take the data reality, which is I come in at X time and there's Y ICD-10 code. I'm dating myself, and these biomarkers, et cetera, like the different elements. Well, the reality of the scenario is I came in and I was having an extremely bad day. I was grieving over my grandmother, having an argument with my partner, et cetera. And so there's all these different things that like data represents like what can be captured, but there's a loss. There's something that we're losing there in terms of like what's actually going on. We can like make assumptions at the bigger picture, but when we're reduced down to these numbers and assessments and evaluations and everything like that, there is something much bigger that we're missing when we have that kind of limited perspective of data.
Couldn't agree more. Today's benefit of large data is counter beneficial to the effort it takes to collect, process, and then make any sense of that data.
But yeah, overall, yeah, I'd love just having that perspective of like, let's look at the data, but let's not. Let's acknowledge that there's different ways that it can mislead us if we're not thinking deeply about it.
I have a perspective on data, but it's not really even data itself. It's the meaning behind data, anywhere, for anything. And it comes from a lesson I learned a long time ago after reading who's now considered the father of modern business management. His name is Peter Drucker. Mm-hmm. He's written 90 plus books about all this stuff. And one quote that stands in mind when it comes to all this stuff, including data, is he said, there's nothing so useless as to doing things efficiently that shouldn't be done at all. Mm. We hear the words data and data analytics, data predictable analytics, all the stuff that today's folks that work with data feed us. And unfortunately, I would love to. Both of my parents are computer programmers. I come from a family of mathematicians. I would love nothing more than for all of this to come true. But I haven't seen it yet. And so in many ways, a lot of what we see about data, and there's some catchphrases like what you don't measure doesn't happen or doesn't change or something like that. And they often attribute that to Drucker as well, even though he never said that. But the truth is, big data has not really panned out yet. And I'm not sure it ever will, especially when it comes to human behavior, because of the example you gave earlier, that even for the same person, a same set of data can mean different things on an hour to by hour basis, depending on the context in which that data is viewed. And if we have this idea of big data where billions of data points are collected just on a single person in a single instance of a particular experience, so what?
Yep.
What are we getting out of that? And I wish we sort of refocused a little bit and either try to get to the bottom of why that is the way it is, or quit and go to let's try a different approach.
So yeah, I would say that we shouldn't worship at the temple of big data, but should instead seek meaningful data. Meaning we should identify an outcome, identify a goal that we have strategically, and then work backwards into the specific data elements that we might need to help enact that change or help make decisions. And big data, the problem with going big is when somebody brags about something that has hundreds of thousands of parameters, then my immediate question is, well, how did you evaluate each of those parameters for their effect? How did you determine causality when it needed to be determined? So when you have a meaningful, focused, purposeful decision around that, and also when you're creating an experience where data, like where if you're going big, like get all the data possible versus, hey, what can we reasonably establish without violating quadruple aim number 4, delivering for our workforce, then we have the ability to have meaningful change and meaningful strategic decisions from our data.
Well, and you said it, right, inadvertently in your sentence just now. Causality. Natural world does not work in a causal way. It works in a correlational way. And correlations are relatively easy to pinpoint, but impossible to make any sense of. There's a guy, he runs a website called Spous Correlation.
That's a fun website.
And he shows you examples of how completely unrelated things correlate to a highest degree possible. And yet, obviously, you know that the price of cheese in Denmark last year does not correlate with suicide rates in New Jersey. And yet, you could show it. You could show the correlation. And so a lot of big data does that. And it does it in pretty much any way you want it to. I could show you pretty much anything correlated to something else. But what does it mean? And in most instances, the answer to the meaning question is either nothing or we don't know.
So I have to go back to our core conversation because there was something that you said what was the term, that French word that you said?
Frisson.
Frisson, that's the official term for the butterflies that you feel when you learn something new.
Like the goosebumps. So,
yeah. So the part that delivered that for me was when you talked about helpers and the lesson that you teach your students about helpers. And I made a comment, Mr. Rogers told us to look for the helpers. Who are they and how do you identify them?
So we're all helpers. This lesson goes back, give or take, maybe 2 million years ago, when this was already roughly 5 million years after humans became sort of as close to the modern version of ourselves as we are. So bipedal, hunker down in groups. And even there, the groups were relatively small, which eventually came across other groups of humanoids at the time and realized that depending on the environment, depending on what time of the year it was much better for them, for everyone, for their survival, to cooperate than compete. And since that day, and now we have modern science to prove it, human beings are the only creature on this planet, as far as we know, to cooperate in large numbers, especially in the times of crisis. So some would say maybe ants do this all the time, bees, but really their cooperation is different. It's more ingrained in their DNA. Ours is cognitively based. Human beings think about this on a regular basis. So if you took even the closest family member in the DNA structure to us and took, let's say, gorillas and filled up the stadium here with 80,000 of them, nothing good would come of this. And yet, every Sunday at an NFL stadium near you, we have tens of thousands of people pouring in, and even though their teams, one by definition will lose, one will win, and most of the time we walk out of there, some with heads down, some with heads up, and repeat the whole thing again the following week. Well, all of that comes from, again, millions of years of evolution, an eventual conclusion that as Homo sapiens we've made, which is it is to everyone's benefit for survival purposes for us to cooperate and help one another than try to outcompete one another. It's only in the last couple of 100 years where with the new economics of especially capitalism, the whole competition has become the driving force of how we relate and establish our connections with one another. But for most of our evolutionary history, we have relied and helped one another. And so literally, we're all helpers through and through our DNA. Where things begin to diverse is when it comes to the kind of helpers you need in various conditions. And so now let's fast forward to the modern world. And I know that if, God forbid, you were in a car accident and you were bleeding on the side of the road after the accident, ideally you would want someone with medical training and education to be helping you on the side of the road. If that's not possible, we have an entire system in this country and many other countries that has been set up over the last couple of decades that helps take lay people and turn them into quasi-formal helpers. We are sent to take first aid and CPR classes. And so most people, especially in the healthcare world, even if they're not nurses, doctors, they have taken a first aid and CPR class. Well, when it comes to behavioral health, same concept exists. We can help other people even though we're not formally trained. And that's because there's two other kind of helpers, other than the formal ones, which are professions like social workers, psychiatrists, psychologists. One of them is a person whose job it is to help people in some way already. These are teachers, lawyers, bartenders, people with whom we interact because of interpersonal relationships that are by definition part of their job. In that interaction, because we're both human beings and because in our DNA is to help others, when someone is experiencing a problem, a challenge, something they're willing to share with the other person, for most part, can't help but help the other person. We listen, most of us don't judge, and we just try to understand what they're going through. The third type is everyone. Everyone is a helper in some way. Your friends are helpers. Your family members are helpers. Your coworkers are helpers. If you're a human being, you're a helper. The difference is they don't know it yet. And so, for example, in this country, and this has been around for about 10 years, it came out of Australia, there's a training called mental health first aid. And it's similar in its ideology to first aid and CPR, where you take a population of lay folks and you train them how to help other people in the most efficient and effective way, but not when it comes to a cardiac arrest, but when it comes to feeling anxious, having a panic attack, or feeling sad and depressed, and so on. And the difference is, for most people, most of the time, they will never have to use CPR and first aid. And I hope to God you don't, if you have been trained. When it comes to mental health first aid, when I've talked to people who I've sent to take these trainings, they tell me that in the last 2 weeks, they've already used the skills they learned, how to help others.
So just to help, I didn't even intend to. Yeah.
Freudian slip.
Yeah. But I just wanted to distill it down because I know we talked about a lot here, but there's a lot of important stuff. Even we started with humanity and brought it down to help. So just to make sure I understood, you outlined 3 categories of helpers. On the at the baseline. Well, actually, I don't even start with the baseline. I'll start with the professionals.
Yeah, formal helping professionals.
Yeah.
Psychologists, psychiatrists, therapists, social workers. These are folks that go to graduate school and get degrees into how to be the best possible helpers. They get paid to be a helper. Just like doctors and other folks in the medical professions get paid to learn how to fix your heart, these folks learn how to fix your mind.
Then there are the professionals that you interact with who are not specific to fixing your mind. Your barber, especially your barber. Respect to your barber and your stylist, because those are good conversations. And then there's everyone.
Correct.
I think there's a good opportunity here to, like you focused on the millions of years of humanity before everything became more of this like competitive mindset. And there's a lot of people who, like, we're going through some dark times right now, and a lot of people would assume that those dark times are based on ourselves as humanity, but we've been on this world for an extremely long time before these systems kind of recently came into place, in which there was the type of violence that we're seeing now and the magnitude of it. So I just wanted to just take the time to highlight, like, hey, there's an optimistic view that we can come out of this, that we're not doomed by our humanity to be dark to each other. Like you said, the instinct is to help. Okay,
so one slight correction to what you just said.
Sure.
And it has to do with the time aspect of this principle. So there's a psychologist, professor of psychology, and a well-written, published, and best-selling author named Steven Pinker out of Harvard that has been writing about this for much longer than I've been out of graduate school. All things being equal, we are living today in the most peaceful world that's ever been, measured by, let's say, the number of lives lost at the hands of someone else. So Steven Pinker has been writing about this for a while, and there's good reasons to believe that his stats are accurate, which means that today we're living in the most peaceful time ever. It may not seem that way, especially with multiple wars going on, with lots of innocent people being killed, but you have to look at sort of the big picture. And cooperation or competition can be viewed in many different ways. One of them is through competition economically, for example, which is this resource competition. If you have this, that means I don't have it, and so we fight for those resources. In that sense, the world has been doing this forever. We've been fighting about food, energy, you name it. Religion, another concept that has been fought around and about for millennia. Today, especially in this conversation, what we're talking about is different kind of cooperation and different kind of helping. We're talking about helping those that we already know are within our, what one of my favorite scientists, Robert Sapolsky, called us's and them's. We're talking about the us's. These are the people, our friends, our coworkers, our family members, and yet most of us still struggle to help them. So it's not some enemy over some imaginary line over there. It's people right in our immediate environment, people that you're going to see in the next 24 hours in your life. How do you help those people? And then even there, the bigger question is not just how are you going to help them, but do they need your help? Do they want your help? And if they do, what is the best way to help them? Not just a way to help them. And again, all of these questions have their right answers depending on the previous set of question and answers. This is why one of the most difficult things in formal behavioral health assessment and treatment algorithm is to figure out what are the right questions to ask, when to ask them, and then depending on what answers are given, what to do with those answers.
Part of me wonders, in a world that's more peaceful, do you, what do you make of some of the statistics that come out around measures of how happy people are and how optimistic they are for the future? I wonder, do you see a divergence between the peacefulness of the world and the availability of food and shelter, but the stats over time, like, which I wonder if you've assailed these stats or anything like that, but like, is there a divergence there? And I wonder what might cause that.
All right, you brought up the big H word. So now we're going to have to dive into it.
Let's go.
Because this is both one of my favorite things to talk about, but also a topic I love to hate. So first of all, we need to agree on operational definition of happiness before any further discussion. So you tell me, what do you mean happy?
It's hard to put a finger on because like if I go all the way down to happiness, it's just really a moment in which I feel good and comfortable, but it feels like a fleeting definition to me. So I didn't come with a definition of happiness.
If I gave you an intravenous shot of heroin right now, you would definitely feel comfortable, joyous, relaxed. You see where I'm going with this? There is no formal definition of happiness, and there's a reason for that. Every person experiences what they may think happiness is in a very different way. And even culturally, we define these things differently depending on where you come from, what language you speak, even what your upbringing was. And so we need some better version of this. And the best definition I know of comes from who I think most would agree is the founding father of the positive psychology movement in the United States and really probably the world. His name is Martin Seligman. He's written many books on this, studied this for decades, and today a lot of his teachings are used in modern science. And he uses this concept he calls PERMA, and it's an acronym where each letter stands for something. The P in PERMA stands for positive emotions, and that's the joy that you just described. So in order to experience happiness, you definitely have to have some kind of joy. I don't necessarily agree with his definition of the word positive emotion, because that itself is kind of arguable. I don't think there's such a thing as positive and negative emotions. But for this conversation, it's a feeling of joy. The E is some kind of engagement. You have to be engaged in life. You can't experience joy in any way, shape, or form unless you engage with life. And a more specific way he describes this comes from all of our research on the states of flow. And what he discovered is that no matter what you're doing, even if whatever you're doing is hard, it could be a sport you're playing, a musical instrument you're playing, painting, whatever it is, but you enjoy doing that thing, and that's why you're doing it, you get into a state of flow. That state of flow adds on to the positive emotion of joy that comes with the P. The R in PERMA stands for relationships. So no matter how joyful your set of experiences are, and no matter how you can get into a flow of experiencing that joy, because we're social creatures, we need other people in our lives. And we need those relationships to be healthy, and we need to have enough of them for us, again, to feel happy. That's the R. The M stands for meaning. It's not enough to have joy. It's not enough to be engaged. It's not enough to have people. You also have to get some kind of personal, as we talked about earlier today, meaning out of whatever it is you're doing. And then the A stands for accomplishments. Goals, planning, all of that has to, at least a little bit, add up to something. I got a degree, I got a job, I got a house, I got a family. You combine all those things together, that's happiness.
And I like hearing the definition. I like hearing, again, like I said, the way that I described it was very fleeting. And that describes something that people can put their hands on as, something much greater than what they could get from. Yeah.
Well, so the fleeting, by fleeting, what you're really introducing here to the definition is a sense of time. And whether you're an Einstein fan and sort of this relativity theory concepts, or even modern neuroscience's version of what is time. Like, do we have time, or it's just our term of it, that we exist in it, and we conveniently make sense of it in whatever way we can? It doesn't really matter. What matters is what neuroscientists that deal with this brain's processing of time call slicing. And there's two very simple examples in most people's lives to understand this from. Sometimes people say, it felt like time stood still. Usually that happens when something traumatic or dramatic happens. Think of a car accident. It felt like everything was in slow motion. The brain perceives and then slices that reality into a million thin slices. And just like in movie making, to have high quality slow-mo in a movie, you need a lot of slices. Flip side, people say, I don't know where the time went. So usually you were so in the moment having such a great time that you look at your watch and boom, time is up. Slices of reality become much wider, almost chunks instead of tiny little slivers. Happiness works the same way. You're either chunking it or you're slicing it. And depending on what is happening with you as an experience, it could go either way. There's one more concept that I want your viewers to remember, and that is the cultural aspect of happiness. In a modern Western society like the United States, a lot of what happiness, the way most people use that term, comes from is a moment by moment sets of joys that come from getting something over and over again. And often, whatever it is that they get, they need or want more of it. More, more, more. And it almost seems like you can't satiate that desire. It's not the same in all cultures, even in other Western cultures. So in Finland, for example, they have a word for it. We don't even have a word for it, but they have a word for it. And it's loosely translated into enough. Here, maybe a word for it would be satisfaction or being satisfied. So you don't need more or better or greater. It's enough. That's their version of happiness. When do you know you've had enough and you know how to stop and not have to want more? Because what we know from purely emotional circuitry is this hedonic treadmill can never be satisfied. There will never be enough if you're constantly looking for more. And so one of great skills, especially young people can learn, is how do I know it's enough? Enough of everything. Like, how do I know I've met the right person? How do I know I got the right job? Do I make enough money? The right house, the right car, whatever. What is enough? And once you make it there, it's not that you're lowering your threshold for happiness. It's that once you've set it, you can dedicate a lot of your internal resources towards other things than just striving to be happier.
The idea that you describe, understanding this, like maybe having a word for it makes it more potent in their culture.
Of course.
Yeah. So it flips the script on chasing moment to moment, but really just having that, again, that enough concept, which I know doesn't even embody everything that you said, but it kind of it creates a different focus of, like, because life, liberty, and the pursuit of happiness.
Yeah.
Life, liberty, and the pursuit of perma or enough.
Yeah. I literally sometimes when I do presentations on this, I have a slide that quotes that concept. And there's an anti-quote to that, which comes from Viktor Frankl. You familiar with?
No.
So Viktor Frankl was Austrian psychiatrist who ended up in Auschwitz concentration camp during World War II. And he wasn't killed because he was a doctor and the Germans used him to help with patients. But in the meantime, he wanted to better understand human nature under extreme conditions. And he now has become a very well, he's dead now, but when he was alive, he became a very famous psychotherapist. He invented an entire field of psychotherapy called logotherapy. And his contribution to the field was from his notes that he took while at Auschwitz, studying people that were in the camps and trying to understand how was it possible that some people almost instantaneously gave up the will to live after ending up in those camps, and others, despite of most horrific circumstances one could ever imagine, had a smiley face and got through it with flying colors. And so, again, I'll spoil the surprise. Those that want to read the book, it's called Man's Search for Meaning, describes that we have in our capacity the ability to, in spite of most horrific circumstances, harness the power of meaning and be able to circum almost anything. What most people know this notion by is whatever doesn't kill you makes you stronger. I don't like using that phrase because 6 million Jews were killed during that war, and millions were killed in concentration camps alone. And so that's not really an appropriate analogy, but that's what most people think of it when they think of this example. It's not necessarily happiness, and it's not even the opposite of happiness or not happiness, but it's this other parallel concept. How do you strive or succeed in the challenges of daily life, which, let's admit it, for most people, most of the time, it's a struggle, right? Every day you wake up, whether you have to or you don't have to, you do certain things that if you were to choose, like if you had another option, you probably wouldn't do it. Even that is challenged by scientists all over the place, and one of my favorite is Dan Gilbert out of Harvard, who looked at specifically sort of this happiness question, and he generalized it a lot more, just how happy are you kind of stuff, depending on your circumstances. And he looked at two very drastic groups, and this is an old study now, so you can Google it. He looked at folks that won a lottery of $1 million or more, and he compared the level of happiness to people who ended up as quadriplegics as a result of some kind of an accident. And he asked them, how happy are you shortly after the two events took place? And as you can imagine, people that won the lottery were very happy, and those that just lost their limbs were not so happy. He resurveyed them 12 months later. You want to guess what he found?
Did he find that there was a reversion to the mean, or that the even more unexpected, that the lottery people were worse off or less happy than the...
They were equally happy.
Okay.
A year after, a quadriplegic was equally as happy as the guy that just won $1 million. So all of this kind of goes back to your concept of time, happiness, and putting it all together, that really this thing is not very good at making sense of time, but even worse at putting happiness and time in perspective.
So we've talked a lot about a lot of things, and the way that we've approached it, the way that I've noticed that you approach it, is to start with a fundamental or a grounding in a historical story, and then bring it back to the relevant or pertinent idea. So I think that there's some learning from that framework of answering a question in its own. But now I'm curious about this mental framework in place that we've been discussing and talking about. Could you talk about some of the things that you're most proud of, as you were talking about, like the health equity initiatives and addressing various factors of the quadruple aim? Any stories I guess related to Care First about this framework in action?
Yeah. Probably the best stories when it comes to all this stuff, and I'm sure if there are clinicians listening to this would agree, are even though anecdotal, but they're stories that come from people that have benefited from the infrastructure. It's the mom that reaches out via email to literally a black hole. It's not any particular person, it's Care First. We have thousands of employees at Care First. She writes the email saying how grateful she was for us being there when her daughter needed us the most. And as you read the details, it was a dire case of an eating disorder where the young lady was losing weight to the degree of where her organs were failing, and we helped her find not only a treatment provider, but now, months later, the young lady is fully recovered, receiving follow-up care, and happily back to school and functioning, quote unquote, normally in our society. It's stories like that. And we have hundreds of them. I personally get many of them on weekly basis. And that's really, as they say, proof is in the pudding. We can look at the data, we can look at the stats, but it's real people sharing their individual stories that help me go to bed every night feeling like we've done something good.
Excellent. And the last question I'm going to ask might be antithetical to your nature.
Okay.
But so this is one we ask all our guests is, we give you a magic wand or a superpower, and you're able to change one aspect of how care is delivered in the United States or across the world.
Yeah.
I'm really curious about the one thing that you would change first.
Okay. This is an easy one. I think about this all the time, and every time I come up with the same answer. The best treatment is no treatment. If you asked 100 people what would they want from a healthcare system, the right answer is nothing. They want to be healthy. If you ask people, choose best health insurance or just being healthy, they should always choose being healthy. The dilemma is that's not the system we're in. And there are three legs in that stool. The first one is sort of the greater medical industrial complex itself. So the care, the hospitals, the doctors, all the people whose job it is to provide medical care. The third leg of the stool are the health plans, the payers, the Medicare, Care First, and others that pay for that treatment. The third leg is the patient themselves. And this is the part that we don't often talk about. Unfortunately, if the ultimate goal is better health, not just better health care, that third leg has to do its work. Each one of us are accountable and responsible for our own health and well-being, which often includes doing difficult things, like eating better, exercising, making sure we get a good amount of sleep, doing hard things when we know those things are the right things to do. And that's the part that we're all not very good at. So my magic wand is to infuse some magic fairy dust into all of us to be able to do those things. Because no amount of medication, no amount of therapy, no amount of procedural medicine is going to solve most of our problems. It will have to come from us, sometimes ourselves individually, sometimes us in groups socially, but it has to be us. And that's hard, and it's even harder if the entire system is set up against that, which is, let's find you a pill, let's find you the most evidence-based practice to do X, Y, Z, not that let's challenge you to do the right thing, and we know it's gonna be hard, we know it's gonna require effort, but you gotta do it. The reason I think that is both the magic wand, one thing I would change, but also I really believe we must do this if we're to improve the overall picture, is because there is no other way. Nature does not know another way.
So for the folks that have just gone on this journey with us and we've talked about a lot, and I'm sure there's some folks that will want to keep up with what you're sharing, what you're doing, what's the best way for people to keep up with you?
Sure. LinkedIn, they can reach me through email. I invite people to actually connect with me, challenge my ideas, my thoughts on things, because I think by having these conversations is how we're going to improve things. And a lot of what seems like competition in behavioral health space, who gets where first, how much money they're making in doing that, how big is their fill in the blank size. I think a lot of that is on the surface. Deep down, most of us, especially clinical people, all we really want to do is help people, and the more people will help, the better. And the higher quality of help those people get, even better then. And so reach out, call, email, and I'll be happy to talk to folks about any of the things we talked about today or other topics of their choice.
Well, thank you again for taking taking the time to give such detail in that thinking. I really hope that at least some folks listening in have absorbed it, challenged it, regurgitated it in some way, and might even come back to this episode in the future just for some reminders to stay back on track if they liked a lot of the things that you were discussing. Well, thank you very much, and also thanks to the audience who's been watching. And with that, we will see you next time. Thank you.